This video is about what happens at a smear test. It is for women with learning disabilities, autistic women and their support.
A smear test is sometimes called a cervical screening. When you arrive for your smear test, you should speak to the receptionist. They'll ask your name and your date of birth. They'll tell you where to wait for your appointment. If you'd like to wait somewhere quiet, you can ask for that. The nurse will try to start your appointment on time, but sometimes they may be running a bit late. It's important to wait for your appointment if you can. You can ask for someone to let you know if they're running late. When it's time for your appointment, the nurse will bring you to a private room. You can bring a friend, a partner, family member or support worker with you into the room if you want. Make sure you give the nurse your health and care passport if you have one. This tells them what they can do to make you feel more comfortable. You might have already spoken about it or been shown before, but the nurse will explain what will happen during the smear test and show you the equipment. You can ask as many questions as you like. The nurse will ask you to remove the bottom half of your clothing and your knickers behind a curtain. They'll ask you to lay down on a bed. They'll give you a sheet of paper to cover yourself with. If you've brought a blanket or a scarf, you could use this instead. The nurse will ask you to bend your legs and open your knees wide. If you find this position uncomfortable, the nurse will give you some options for how to lie on the bed. The nurse will use a speculum to see your cervix. There are different sizes to suit your body. A speculum is made of plastic and it's used to open your vagina slightly. Once the speculum is in place, the nurse will use a small soft brush to collect some cells from your cervix. Try to relax as much as possible. You can do this by listening to music, taking steady breaths, or talking to the nurse or someone you've brought with you. This part of the test is very quick. It should only last a couple of minutes. Some women might find their smear test a bit uncomfortable, but it shouldn't be painful. If you're in pain during the test, make sure you tell the nurse. There are things they can do to help. You can stop a smear test at any point by saying stop. Some nurses will give you other ways to stop, like holding up a stop card or raising your hand. You can talk about this before your smear test starts. Once the smear test is finished, the nurse will ask you to get dressed. The sample will be sent to a lab to check. They'll check for a virus called the human papilloma virus, HPV. If HPV is there, the lab will also check the cells to see if they're healthy. The nurse will tell you about how you'll get your results. Some women might have some light bleeding from their vagina after the smear test. This will go away in a few hours. If this doesn't stop, you should call your GP. Now you've had your smear test, you can watch our video on getting your results.